The fluorescent lights of my research lab hummed quietly as I reviewed the latest test results. After 2 years of work, thousands of trials, and countless setbacks, the data was finally conclusive. My novel treatment for antibiotic-resistant infections worked, not just in petri dishes or animal trials, but in actual human patients. Dr. Sarah Chen, my research assistant Mike, stuck his head in the door. Your mother-in-law called again. She said you're late for the family dinner. I glanced at my watch and sighed. Right, the monthly Martinez family dinner, where my in-laws would once again question my life choices and compare me unfavorably to every other doctor in the family. Did you tell her I was working? I tried, she said, and I quote, playing in a lab isn't real doctor work. I carefully saved my files and locked the sensitive data in our secure server. Tomorrow morning, the New England Journal of Medicine would publish our findings, potentially changing how we treat one of medicine's most pressing challenges. But tonight, I had to endure another round of familial disappointment. The Martinez family home was a sprawling mansion in the city's most exclusive neighborhood, bought with the profits from my father-in-law's chain of successful private hospitals. Carlos Martinez Sr. had built an empire on traditional medical practices, and he expected his children and their spouses to follow in his footsteps. Finally, my mother-in-law Elena's voice carried across the marble foyer. We were about to start without you. Everyone else manages to arrive on time, despite having real medical practices to run. I kissed her cheek, ignoring the jab. My husband Miguel squeezed my hand supportively as we entered the dining room. The usual suspects were all there. Carlos Sr. at the head of the table, Elena to his right, Miguel's brother Carlos Jr. and his wife, a proper surgeon, beside them. Miguel's sister Isabella, another successful hospital administrator, sat with her husband, a prominent cardiologist. Sarah, Carlos Sr. boomed, still hiding in that little lab of yours? When are you going to join the real world of medicine? My research is going well, thank you, I replied, taking my seat. We're making significant progress. Progress? Elena scoffed. 2 years, and what do you have to show for it? Meanwhile, Carlos Jr. just opened another surgical center, and Isabella's hospital wing is breaking records. I thought about the data locked in my lab's server, about the patients who'd recovered from previously untreatable infections, about the pharmaceutical companies already competing for licensing rights. Sometimes important work takes time, I said carefully. Not everything in medicine produces immediate visible results. Visible results pay bills, Carlos Sr. declared. This research obsession of yours, it's not what we expected when Miguel married a doctor. Speaking of which, when are you two going to give us grandchildren? Or is the lab more important than family too? Miguel started to object, but I touched his arm. Tomorrow would change everything. Tonight, I could endure one more dinner of subtle insults and not-so-subtle disapproval. Carlos Jr. launched into a story about his latest surgical triumph, and Elena beamed with pride. That's what a real doctor does, she said pointedly. Saves lives directly, not theorizing in some laboratory. I pushed my food around my plate, remembering the faces of the patients in our clinical trials. People who'd been dying from untreatable infections, who'd exhausted every other option. People who were now healthy thanks to our theoretical work. Sarah's research could help thousands of patients, Miguel defended me. He was the only one who knew the full scope of my work, though even he didn't know about tomorrow's publication. Or it could waste millions in grant money, Carlos Sr. countered. Money that could fund real treatments in real hospitals. Like your hospitals? I asked quietly, where you're facing an increasing rate of antibiotic-resistant infections. The table went silent. Carlos Sr.'s hospitals, like many others, have been struggling with this exact problem. It was why I'd chosen this research focus in the first place, though I'd never told them that. That's an industry-wide issue, he said stiffly, one that real doctors are working to solve. Really? I couldn't help myself now. And how's that working out? Elena's face darkened. At least they're trying, instead of hiding in a lab playing with petri dishes. A real doctor works in a hospital, not some lab. 2 years of research and nothing to show for it, Carlos Sr. added. If you were at one of my hospitals, you'd have been fired by now. I stood up slowly, my chair scraping against the expensive hardwood floor. Check tomorrow's New England Journal of Medicine, I said calmly. You might find something interesting. What are you talking about? Carlos Jr. demanded. You'll see. I turned to Miguel. I'll wait in the car. As I walked out, I heard Elena start in on Miguel. That wife of yours, always so dramatic. When will she understand that real medicine happens in hospitals, not laboratories? In the car, Miguel joined me a few minutes later. Want to tell me what's happening tomorrow? I smiled, pulling out my phone to show him the embargoed press release. His eyes widened as he read. This is incredible. Why didn't you tell me it was ready for publication? Because I needed to be absolutely certain. The data is conclusive now. Our treatment works, Miguel. It works better than we even hoped. He read further, his expression growing more amazed. The pharmaceutical licensing, these numbers. Sarah, this is going to change everything, I finished. Including your father's hospitals once they stop being too proud to try new approaches. The next morning, I arrived at my lab early. The New England Journal of Medicine would release their new issue at 9 a.m. Eastern Time. By 9:01, my phone was already ringing. The first call was from the Dean of Medicine. Dr. Chen, my office now. The second was from a major news network. The third was from Carlos Sr. I ignored them all, watching as the story spread across medical news sites. Bar 8th novel treatment shows 94% success rate against antibiotic-resistant infections. Research team led by Dr. Sarah Chen revolutionizes infection treatment. Medical breakthrough could save millions of lives. Mike burst into my office, grinning. Dr. Chen, CNN is outside. Tell them I'll give a statement at the press conference this afternoon, I said, still watching the headlines multiply. My phone buzzed with a text from Miguel. Dad's having a meltdown in the hospital board meeting. They just realized your treatment could have prevented their latest infection cluster. Another message popped up, this one from Elena. We need to talk. Now. I thought about all the family dinners where they dismissed my work. About Elena's constant remarks about real doctors and Carlos Sr.'s dismissal of research as a waste of money. I'm busy in the lab, I texted back. Playing with petri dishes. The press conference was scheduled for 2 p.m. By then, the story had gone global. Medical professionals worldwide were downloading our research paper. Hospitals were contacting us about clinical trials. Pharmaceutical companies were increasing their licensing offers by the hour. As I prepared my presentation, I thought about last night's dinner, about all the dinners before it, about how sometimes the quietest work makes the loudest impact. Today, everyone would learn what playing in a lab could really accomplish. And my in-laws? They were about to discover that sometimes the most important medical breakthroughs don't happen in their precious hospitals. They happen in the labs they've been too proud to understand. The medical school's largest auditorium was packed for the press conference. Television cameras lined the back wall, and journalists from around the world filled the seats. In the front row, I spotted Carlos Sr. and Elena, who'd apparently pulled strings to attend despite not being on the approved media list. The Dean of Medicine stepped up to the podium first. Today marks a historic moment in medical science. Dr. Sarah Chen's breakthrough in treating antibiotic-resistant infections represents one of the most significant advances in modern medicine. But rather than me telling you about it, let me introduce Dr. Chen herself. As I took the podium, I saw Elena whispering to Carlos Sr., probably noting that I wasn't wearing designer clothes like their successful doctor children. I smoothed my simple lab coat and began. 2 years ago, our team began researching a novel approach to treating antibiotic-resistant infections. Traditional methods were failing and hospitals worldwide were losing patients to untreatable infections. We needed to think differently. I launched into an explanation of our treatment methodology, using slides to illustrate the revolutionary approach we developed. The room was silent except for the furious scribbling of journalists and the clicking of cameras. In our clinical trials, we saw a 94% success rate in cases where all other treatments had failed. Patients who were considered terminal walked out of hospitals completely cured. The questions came rapid fire. How soon can this be implemented globally? What are the cost implications? How will this affect current hospital protocols? I answered each one precisely, watching my in-laws' expressions change as they began to understand the magnitude of what their failed daughter-in-law had achieved. Then came the question I've been waiting for. Dr. Chen, major pharmaceutical companies are offering unprecedented licensing deals. What are your plans? I smiled, thinking of the decision I'd made weeks ago. Our treatment will be licensed under an open-source medical patent. Any hospital or medical facility can implement it for a nominal fee that covers only research costs. This breakthrough belongs to everyone. The room erupted. Open-source medical patents were almost unheard of for treatments this significant. I saw Carlos Sr. nearly fall out of his chair. He'd probably been calculating potential profits for his hospital chain. But the pharmaceutical offers. Someone called out. They're saying billions. Medicine shouldn't be about profit, I said firmly. It should be about saving lives. Our research was funded by public grants and university support. The public deserves access to the results. After the press conference, Elena cornered me in the hallway. Gone was the condescending mother-in-law who'd mocked my playing in a lab. In her place was someone who looked almost afraid. Sarah, she began, we need to discuss the licensing for our hospitals. Carlos is prepared to make a very generous offer. The same hospitals that dismissed research medicine as a waste of time. I interrupted quietly. The same hospitals that would have fired me for taking 2 years to develop this treatment. We were wrong, she admitted, the words seeming to physically pain her. We didn't understand. No, you didn't. And you didn't try to understand. You were too busy measuring success by surgical schedules and hospital wings. Carlos Sr. joined us, his face a mix of emotions. Name your price, he said bluntly. Exclusive rights for our hospital chain. Whatever you want. I thought about all their fancy dinners, their subtle insults, their dismissal of research medicine. There is no price, I said. The treatment will be available to every hospital that needs it, including yours. But you'll implement it alongside every other medical facility, no special access. But we're family. Elena protested. Family? I laughed softly. Yesterday I was a failure who wasn't a real doctor. Today you want special treatment? That's not how medicine works. That's not how any of this works. The next few months were a whirlwind. Our treatment protocol was implemented in hospitals worldwide. Survival rates for antibiotic-resistant infections skyrocketed. Medical schools started emphasizing research alongside clinical practice. The Martinez family dinners changed too. Gone were the snide remarks about real doctors. Instead, Elena and Carlos Sr. sat quietly while other family members asked about my research. Carlos Jr. even admitted that the treatment had saved several of his surgical patients who would have died from post-operative infections. 6 months after the breakthrough, I received an unexpected visitor in my lab. Isabella, my surgeon's sister-in-law who'd always sided with her parents about real medicine. I was wrong, she said simply. We all were. I've seen your treatment save patients I would have lost a year ago. I'd like to learn more about research medicine. That conversation led to a collaboration between my lab and her hospital department, combining clinical practice with research in ways that helped advance both fields. A year after the publication, I stood on stage accepting the Lasker Award, one of medicine's highest honors. In my acceptance speech, I addressed the divide between clinical practice and research that had driven my in-laws' dismissal of my work. Medicine isn't just what happens in hospital rooms, I said. It's also what happens in quiet labs, in late-night research sessions, in years of patient investigation. Every major medical advance came from someone willing to look beyond current practices and ask what if. In the audience, I saw Elena dabbing at her eyes with a tissue. Carlos Sr. sat straight-backed, finally showing genuine pride in his daughter-in-law's achievements. The open-source licensing decision had transformed not just infection treatment but the entire approach to medical patents. Other researchers followed our example, creating a new model of accessible medical innovation. Lives were being saved not just in wealthy private hospitals but in small clinics and developing nations. 2 years after the breakthrough, I opened the Chen Research Institute, funded by the nominal licensing fees from our treatment protocol. The institute focused on collaborative research between clinical practitioners and laboratory scientists, breaking down the artificial barriers between different types of medical work. And yes, we even partnered with Martinez hospitals, though Carlos Sr. had to accept that he couldn't control the research directions or claim exclusive rights to discoveries. At the Institute's opening ceremony, Elena approached me with an unexpected request. Would you speak to my women's group? About research medicine. Many of their children are choosing between clinical practice and research, and they don't understand the value of laboratory work. I smiled, remembering all her past comments about playing in a lab. I'd be happy to, I said. After all, someone needs to explain that real doctors come in many forms. The last breakthrough came at another family dinner, but this one was different. Instead of criticism and comparison, the conversation focused on collaboration between clinical practice and research. Carlos Jr. discussed how research findings improved his surgical outcomes. Isabella shared excitement about her hospital's new research department. And Carlos Sr., who had once dismissed my work so completely, finally said what I never expected to hear. I was wrong about research medicine. Sarah showed us that sometimes the quietest work makes the loudest impact. As I looked around the table, I realized that my breakthrough hadn't just changed medicine. It had changed minds. It had shown that innovation doesn't always wear surgical scrubs or work in hospital wings. Sometimes it wears a lab coat and spends years pursuing a possibility that others dismiss. Because sometimes the biggest medical breakthroughs don't happen in operating rooms. They happen in the labs where people dare to think differently, work patiently, and ignore those who say it can't be done, even if those people are family.